Here we go. Hello, everyone. My name is Ricardo Videla. I am a adjunct professor at the University of Tennessee. So some of you may know me, some others may not. I left UT in January of 2023. I am now in Argentina. And today I'm going to talk to you about a program that we started about 5 years ago, where we do veterinary work free of charge in rural, vulnerable communities in northern Argentina. So we are a group of veterinarians, veterinary students, and staff, and facilitators that work together. So it's a multicultural team, experience, program, whatever you want to call it, it's everything. But usually we have 6 people coming from the US, typically 4 students, and then 2 faculty or staff. And then on the Argentinian side, we usually have 3 to 4 veterinarians. We like to have also one, at least a student from Argentina. And then in some years, we've had just one facilitator. That was a mistake. And then other years, we've had up to 3 facilitators. So the reason why we started this program was, in the hopes to improve the living conditions of the people in these vulnerable areas by doing what we know, which is veterinary medicine. Um, and we thought, okay, so, a lot of them, they eat the meat from the goats and the cattle, and they have dogs. And if we can provide some veterinary services, then maybe we can make a contribution in some way. So we wanted to concentrate on population control by doing high volume space and neuters and also zoonotic diseases. So this is to show you a bit of where we are located. As I said, this is in Argentina, which you can see there in green in southern South America. And then we go to the most northern province, which is Salta. And we go to eastern Salta. And what you see on the bottom left, it's a Google Earth image of the town where we are based, which is La Unión. So very small, about 5,000 people live there. And then every year when we go, we also visit some of the towns nearby. And it's very dry, as you can see in the picture. There's barely any grass. Here are some images. The sky is beautiful, and every year that I go, I've learned to like it more and more. There is the trees, everything is very different right there. Also, it's hard to understand, the way of living for some of us that come from a very different culture. Um, but there are reasons for all of that. There is a lot of mixed communities there, but there is a witchy indigenous groups, and these groups have been displaced of their lands, have been abused by the white. So there is a lot of challenges when it comes to communication, trust, associated with that history. So historically, the witchy people used to devote their time to fishing, hunting. They collect the algaroba beans, and then they would save that to make for food for themselves and their animals. They have a strong sense of community. They like to live in mud houses, which are cooler. It's very, very hot in the area. And they are organized groups, and each group has their chief. And there's a lot of things that I didn't know, and probably a lot of things that I still don't know. But you have to seek permission to work in the communities from the chief. So a lot of the people cannot decide from themselves the way we are used to. Their organization is very different. So it was a lot of work to set this up, but we had a lot of energy. So we collected supplies, we investigated. I mean, beforehand, Valeria, who's a veterinarian and friend from Argentina, and I had traveled northern Argentina to find community. So we had visited this community and thought we could do good work there. And then, we were all excited. And when we arrived and set camp there, we thought that people would be in line, hoping to get free veterinary services. But that was not what we found the first year that we went. This was the situation. This is an actual picture of Christina, the local vet, going, house to house, telling people what we were doing and trying to convince them to come to us. But there was very little interest or trust. But the picture that you see on the left is an actual picture of last year. So things have evolved, have changed, thankfully, for us and for everyone and for the community. So now people do come to us. But at the beginning, that was a big surprise, and also like disappointment for us. But we ended up doing a lot of work, but it was a lot of time that we spent trying to convince people to get the care that we were bringing to their animals. Also, every time we go, we prepare for the trip and we have a talk with everyone that is coming, because we have our preconceptions of, what basic needs are, and happiness and poverty and all of these concepts that are very complex. So usually the advice is, go there with an open mind, try to meet the people, and then see what it actually is for them. So the lady that you see in the middle, there is Emilia. Unfortunately, she's passed away, but she's Christina's mother. Christina is a local vet, remember. And Emilia, and that's her house. And this is actually outside of her house, but her house is very basic. And sometimes she would opt to sleep out there because of the weather and because of also culture, because she grew up there and that's part of the culture. But for us, that would be something that is very poor, has a lot of needs. But if you sit down and talk to her and laugh and hear her stories, she is a well-educated, she was a well-educated lady. She was a nurse. Um, so, so it's really a different mindset um, that people have there. It's a completely different lifestyle. And I don't like for us to come and categorize them based on our ways of measuring. Also, this is a One Health symposium, so I think that there is a lot of that going on in this program. But there are things that I really didn't think about that I think are very important. Like one concept was, that some people were not familiar with the concept of anesthesia. So they thought that maybe their animal had passed once we had heavily sedated the animal or anesthetized. And if you think about it, this is very important also for human health because there is a lot of lack of trust from some people in these communities towards traditional medicine, even for themselves or their kids. So if we start with the animals and hopefully they are more open, which now they are much more open to us practicing medicine in their animals, we hope that that can help build trust for medical care for the people as well. That's a bag of gummies, and it's just showing how hot it can get there. The first year that we went in October. There was a mistake, super hot. We could barely work. So now we go in July, which is winter time for Argentina, and it's a lot more pleasant. Um, Kids are usually the first one to break the ice. And we were lucky the first year that we had brought some coloring books. And maybe this is inappropriate, but we ended up bribing the kids and saying, hey, if you want the books and the crayons, you need to bring your animals to us. And that's what they did. The kids started bringing their puppies and dogs and cats and goats to us. And then they would get a coloring book, which they loved. Now we don't really need the coloring books anymore. We still, if we can, take them. But the kids were the first one to approach us and to interact with us. And later it takes time. Um, so for us, we want to be efficient because we know that we're maybe only there for that one day because we visit different communities. And then like maybe the first hour and a half, we don't do much because people are slow to approach us. And then late at night, there is a lot of people that are hoping to get our services. Also, even animal restraint. It's a thing, so it's not uncommon to maybe see a person grabbing a piglet by its rear leg, just hanging, head down and chatting, or even the dogs. Sometimes they grab them from the arms. So we also, Christina is very good at that, and we also try to show them a few tips to improve the quality of life for the animals. It's fun because you never know what to expect. We see anything that they bring to us. Of course, many things are chronic because Christina knows where we're going, so she'll save things that are challenging for us. But then, there's an armadillo, there's a little parakeet, and anything. Really, we never know what we're going to be seeing once we're there, and that makes it a lot of fun. Also, we learn to be creative by seeing what they do. So here you can see a guy that brought the cat inside the case of a fan, which were great. And then we were working at a farm, and then somebody came to buy three goats and a sheep, and he transported the three goats and one sheep in the back of a motorcycle, as you can see there. We were very impressed. We also learn to receive because we go there with the concept of we are coming here to help you and to show you. And that is also a different mindset because we also learn a lot from these communities and their people. And this is a farm that we go to every year, and we do large animal work and a bit of also small animal work. And this guy wanted um, to share a meal with us. And so he every year will prepare meat and a salad and have us eat lunch there. But for some of the people in the group, that was very challenging to accept all of that from somebody that we um, conceive as, humble, very humble. Um, Also, it's a different mindset for resources. So this is the guy that you see there on the right, and that is his oven. And he was very proud of his oven. And he told me, can you believe that some people even buy things like ovens when you can just do this and cook in this way? And it's so good. So he was very proud. Water is scarce. So that has been a challenge. Like the first year, I think we brought like shampoo for fleas, and well, nobody's going to do that because there's no water. Some years there's barely enough water for them to drink. So that can be a challenge in so many ways. Um, these um, these pictures I took at the local hospital, which is right across from the veterinary clinic where we do some of the work, which is Christina's clinic. So you can see the sign about hydatid cyst disease. Also, every year that we go, we vaccinate all of the animals that we can for rabies. Um, and now the past few years, we've been getting rabies vaccines from the government, thankfully. So all we have to do is inject all of the animals that we can with that. Also, there's leishmania in the area. There's Chagas, so we do some work with that as well. That dog inside the hospital is there because the past 2 years, the hospital director has allowed us to use the facility so we can use their x-ray machine for the animals. They've run some blood work for us as well. They've been very, very kind and very much willing to work together with us. They gave us an oxygen tank for our anesthesia machine. So it's been really neat to work together with them. So here you can see a couple of Leishmania cases. Every year we've had some positives. We don't have a ton of tests that we bring, but we always bring enough tests to leave some to Christina um, that she can use after we have left. We have a WhatsApp group, so she'll always share when she picks up on another case. But the cutaneous form is what we've seen the most. You can see some lesions affecting the nose, some changes in the nails, and also dermatitis. And we've gotten better at picking up on these cases. So here is a little bit about leishmania. So it's transmitted by the sandfly. So it's not that the dog is directly gonna um, infect a human, um, but also it's a reservoir. So it's not good to have infected dogs in the community. Most of the cases we've been able to euthanize, but also euthanasia is not something that people are very used to there. So the dog in the previous dog on the left, we did not get permission to euthanize, so we have to report these cases to the College of Veterinarians in the province of Salta, which we've done. And then um, all we can do is provide ectoparasite control for these dogs. Um, and report it. But usually we've been able to euthanize these dogs and make people understand that it's a risk to keep these dogs in the community. Um, Chagas disease is something that we knew was in the area and something we're very careful with when we go there ourselves. In 2022, that's Dr. Nicole Safransky, and collected blood from 48 dogs, and then later submitted those to Buenos Aires to a lab for testing for Chagas, and two of the dogs came positive. Again, it's not that the dog is going to directly transmit Chagas to humans, but um, it's a good way of knowing that the disease is in the area, and if there are infected dogs, then we know that the people are at risk. Because it's the triatoms that transmit the disease, and we know that there are infected triatoms if there are infected dogs. We also have to be careful ourselves with blood because one could potentially get infected if there is direct contact of blood with a wound. So that's something we're careful with. So a lot of it is the, intercultural exchange, and that is so rich. We every year try to visit a local high school and talk to the students and share some of our stories and listen to their stories, and that is so valuable. Um, a big challenge for me has always been trying to um, negotiate between the group in the US and the Argentine group, because the Argentine group barely sleeps and they want to eat dinner at 11 p.m. and that doesn't really work for everyone. So even the most simple things can be a challenge, such as making sure that we get somebody to cook lunch for us and dinner, and that it's not so late, and have a bit of self-time. That's very challenging. When we go for a week, so it's very, very intense. The whole rotation is 2 weeks, but there is 8 days that we spent at these communities. Family is very important to us, and it's very important in the Argentine culture, and it's part of this program. So there in the picture on the left, you see Valeria with her sister and her nephew. They both have come as facilitators. On the right, you see Eduardo. He's my uncle, and he's come at least 3 years already, and he serves as a facilitator. And also a lot of emotional support because we go through a lot of emotions, everyone that is involved in this program. So it's been a great help to have family support as we do this work. We've also learned how important it is to have somebody that is skilled in anesthesia, because we were getting a bit of a bottleneck with surgeries. So that we do about, I think last year we did something like 150 something surgeries in that 1 week, but we do a lot of clinical work, a ton of deworming, clinical cases, and so it can be a challenge. So Arancha came last year, and then we had Juliette Piquet, anesthesiologist, come the year before, and that really has been a game changer. A lot of it is about building connections and over the years. So that's Brita, the dog that you see with me, and over the years, and I love seeing her every year. I love that dog. That horse that you see is the same horse the year prior, and when we got to go back. And then even for the people, now it's very common that we have more invitations that we can accept for people that want us to go and share some time with them at their houses. So some of the, a lot of are leaky and anaplasma. So a lot of the dogs are pale, anemic. So we bring a lot of tests for that. Parvovirus, that's a dog with a tumor affecting its gums. So a lot of things. I think that this program transforms us all. We all come back a different person in some way or another. And I am very proud of being part of it. And this is a very short amount of time to tell you about the program, but I will be connected for questions if anyone has any questions. We do have a Instagram with a bit more information if you want to follow us on Instagram. That's also one of my favorite pictures because you see how much, even though they don't have much, you can see how much they care about this dog and how they've created a coat for it. It was, even though it's usually hot, the last year we had a bit of cold weather when we went. Thank you so much for your time.